recently when I was scrolling through TikTok late night after I'd put my kids down to bed, I saw a video of an influencer who was showing her blepharoplasty recovery journey. She received both positive and negative comments. It was really interesting to see such a wide mix. Now, blepharoplasty surgery is where you can remove excess skin from your upper eyelid. It can be done purely for cosmetic reasons, such as you just don't have enough space here. You want the look of having a more open or rested or youthful eyelid. It can be done for medical reasons, such as so much laxity that it's causing visual field deficits. There's a lot of reasons that somebody would look into having something like this done. But I find as women, we should support women in their journeys and what they're doing. And so it was really fun to watch her be really transparent. In my practice, it's something where sutures are usually out by day 5. If we're doing just an upper lid blepharoplasty, by day 7, you're back to makeup and back to life. So it's a very mild procedure that can be done under local IV sedation and can make a big difference when you're trying to just get that refreshed look. Right, now to get into the questions that I got during last week's post where I just said, what questions do you have about lower eyelid surgery? I got over 30 different questions, so I'm gonna try to cover some of that now. So one of the questions that we got was about fat in the lower eyelid. Now, do I remove it? Do I transpose it? Do I add fat? So yes, yes, and yes. It is one of those things where it all depends on your specific anatomy. Whether I am doing a transconjunctival approach where I'm going from inside the lower eyelid and there's no external cuts or scars, whether I'm doing an open approach where I make an incision underneath the lash line and doing a skin muscle flap, whether I'm just doing a skin pinch. Those are all things that play into your anatomy, your goals, and what other procedures are going to be paired with this specifically. If you're one of those patients that has puffy lower eyelids, a lot of times that's going to be a situation in which we're going to be removing some of the fat that's there, particularly if the puffiness sticks out further than your cheek and you already have nice volume in your cheek. If you're a person who is a little bit hollow, a little bit flat in your mid-face, that's something we're doing a fat transposition where we're not actually removing the fat, but we're actually replacing it and bringing it down and tacking it into place lower. Then I would be doing fat transposition. We would be leaving fat or adding fat through fat grafting if you're very hollow here. So again, it's something where it's very specific to the patient, very specific to their anatomy. It is not a one size fits all. And that's why having a consultation, when we do virtual, we have you send in a bunch of pictures from different angles and different lighting. But a lot of times the lower lid one is where the in-person physical exam is key and will be the deciding factor of what approach we're gonna take. So I had a patient ask me today if they should defer doing their eye surgery until they're ready for their facelift surgery. And it's something where I think doing eyelid rejuvenation is really appropriate to do whenever you're physically ready for it. If you're having brow ptosis, if you have excess skin in your upper lids, if you're having puffiness in your lower lids or excess skin and crepiness, you can do eye rejuvenation surgery at any time that you're physically ready for it. You don't have to wait until you're ready for your facelift. Most routinely in my practice, what I'm actually noticing is patients are doing eyelid rejuvenation in relatively younger ages, in their late 30s, early 40s, and then coming back in and doing facelift surgery in their 50s. And that's something where at that point, if we need to be retucking a brow, pinching the upper eyelid skin again, then we can be doing a revision at that point in time. Let's talk about the transconjunctival lower lid blepharoplasty. So this is when I approach it from inside the lower eyelid. That's your conjunctiva, which is the inside. That is where I don't make any incisions on the outside of your eye. This is a great approach for patients who have good skin quality here. They don't have a lot of excess skin, and we're really just trying to remove any puffiness or fat pads there or reposition them. And if I'm repositioning, you're gonna have a few little sutures out here that last for about 3 to 5 days. If I'm just removing, there's going to be no external sutures at all. And then even when the sutures are there for transposition, they're cut, and it's not because there's any skin that's been cut, it's just to hold the fat in place while it's healing. This is a great approach usually for my younger patients, again, with very little skin quality issues and no excess skin. A lot of times we'll pair it with a laser resurfacing, and that will really help stimulate some collagen, help with texture and any pigmentation issues. One of the questions that I got was about open lower lid blepharoplasty. So there's a lot of surgeons that just don't do the open approach, and I think that's just because they aren't comfortable with the technique, or maybe it's because they're not comfortable with picking whether the patient is a good candidate or not. So if you have significant lid laxity, where it's something where you're at risk for what we call ectropion, where your lid can pull down, or you don't have enough mid-face support. So if we're doing an isolated lower lid on a much older person with very little lid support, that's somebody who might not be a good candidate for an open lower lid blepharoplasty. Or if we do open lower lid, we do it with something that's called a tarsal strip, which is a lower lid tightening. But when you're pairing your lower lid surgery with facelift, a lot of times you gain support of that lower lid with that really nice vertical lift that we get with that extended deep plane by lifting here. So when we do that, we can end up with a little bit of folding of skin here, but also more lower lid support. So that gives us room to do an open lower lid blepharoplasty. With an open, we make an incision just underneath the lash line right here. That gives us access to these little fat pads right here where we can either remove, reposition, we can remove excess skin and kind of tighten the skin at the corner, or do some fat grafting such as some nano fat or micro fat injections to the area if volume's needed.